So today we have studied the different causes of the jaundice, right?
Jaundice.
Last time we have studied the physiology of the jaundice,
Yes.
and today we have studied the pathology of the different causes for the jaundice.
Yes.
First of all, we studied the pre-hepatic causes.
Pre-hepatic.
Pre-hepatic means that there are problem is before the liver,
Yes.
either in the blood or spleen or bone marrow or blood cells, right?
Yeah.
The problem is before the liver.
Yes.
Then the pre-hepatic causes we studied polycythemia. Polycythemia is a condition in which there are many red blood cells.
Yes.
Red blood cells are overproduced.
Yes.
That is called polycythemia. Then the second cause we study spherocytosis. Spherocytosis in which the red blood cells become round. Red blood cells become round. It's called spherocytosis. Then we study the sickle cell anemia, in which the red blood cells become like sickle. Sickle. The red blood cells become like sickle. Then we study the malaria. Malaria, in which the red blood cell mosquito bite and the red blood cells become infected, and that we call malaria. Then we study thalassemia. Thalassemia. Thalassemia is a condition in which there is a problem with the globin chain, right? Globin chain are underproduced. That is called thalassemia. Then we study splenomegaly or hypersplenism. Yes, splenomegaly or hypersplenism, in which spleen overwork. Yes, and spleen cut down many red blood cells, right? Break down many red blood cells. So these are the causes pre-hepatic. Then we study hepatic causes. Hepatic causes mean the problem is in the liver. The first one we call hepatitis. Yes, liver infection. Liver infection. Then we study cirrhosis. Yes. Then we study hepatic cancer. Yes. Cancer, or we can also call liver cancer. Liver cancer. Then we study intrahepatic stone. Intrahepatic stone. Yes, means the stone is here, inside the liver. Inside the liver. Intrahepatic stone. Then we study Gilbert syndrome. Gilbert syndrome. Yeah, the Gilbert syndrome is a condition, it's a genetic problem in which gluconyl transferase is absent or low in quantity. Yes, that we call Gilbert syndrome. So these were hepatic causes. Then we study post-hepatic causes. Hepatic means the problem is after the liver. Problem is after the liver, either gallstone or the gall duct, common bile duct, or the liver or somewhere else. Then in the post-hepatic we study the gallstone. The main and important cause, right? Very common cause. Gallstone means there is a stone in the gallbladder. We all study pancreatic cancer. Pancreatic cancer, mainly the head of the pancreas. Mainly the head of the pancreas. Pancreatic cancer. So these were the different causes for the jaundice. Pre-hepatic, hepatic, and post-hepatic. Then we study signs and symptoms. Right? Signs and symptoms. The first one is yellow skin. Yes, the skin becomes very yellow. And the yellow sclera. Sclera means the white of the eye. The white part of the eye is called sclera. So it becomes yellow. And the itching. Right? Itching. The patient feels itching. And then nausea and vomiting. And then white stool, black urine, and loss of appetite, and loss of weight. And then many other symptoms, depending on the cause. Then we study the diagnosis. That for to diagnose this patient, we can do blood routine test, liver function test, bone marrow biopsy, and ultrasound, and CT scan, and urine test, and stool test. Yeah, so the different tests we can find depending on the cause, right? So the sign and symptom for the jaundice and the different tests we do and find these problems depending on the cause of the jaundice, right? Because the jaundice can have many causes. So that was something about. Yeah.